So the Washington Post published numbers showing a triple, I think, in the number of cases in the last month, a tripling of the number of infections. What does that suggest to you about what the fall will look like for us?
Well, I think what the fall will look like will depend upon the success of our vaccination program. And we are seeing an increase in the number of people who are rolling up their sleeve and getting vaccinated. But as we've been talking about, this Delta variant is extremely dangerous. It is significantly more contagious, more transmissible than the previous forms of the virus. And there is evidence that it can lead to quicker onset of disease and more severe disease. So I think that the prospects for the fall could be very challenging. However, if we are able to continue to ramp up our vaccination program, that's the most important way to protect people in the fall.
So another unsettling piece of news recently came from the CDC director who thought that the virus could only be a few mutations away from a variant that could potentially escape vaccines. How, speaking as a scientist, I've asked you as a pediatrician, how does that inform your thinking going ahead, and how should it inform messaging to people who are still hesitant about taking vaccines?
Well, whenever the virus, it has significant community spread and transmission, and there's lots of cases, then you can see the development of variants. It has to do with how the virus evolved. And so the way to actually decrease the amount of variants that we would see would be to increase our vaccination program in the United States and to increase the vaccination programs across the world. I think that it should inform people about the importance of getting vaccinated now. We have a tremendous safety record with these vaccines. Almost 350 million doses of the vaccines have been given in the United States, and countless millions more across the country. They have a remarkable safety profile, and we know that they are effective against the Delta variant in terms of people getting very sick, in terms of being hospitalized, etc. And so now is the time for people to get vaccinated, and that's the best way to protect against the development of these variants.
So are vaccines really the only way we're going to stop this thing from spreading?
Well, there are three tools in our public health toolbox since the beginning of the pandemic, and I have been saying this in Pennsylvania and now nationally. The first is containment. Containment means significant rates of testing, and then notification of those that are positive, and contact tracing, finding out who their contacts are, and then having isolation and quarantine. So that's a way to contain the virus. The second tool in our public health toolbox is mitigation. Mitigation includes, for example, the masking recommendations that we just came out with, previous recommendations that limited the size of indoor and outdoor gatherings, etc. Mitigation is very challenging for people, but it can be very effective. And the third are medicine. One is the most important, is our safe and effective vaccination. But the other I'd like to emphasize are actually medicines such as monoclonal antibodies for the virus itself. We have a safe and effective monoclonal antibodies that can be given to people who have the virus. It needs to be given early in the course, especially for those who might be more susceptible to getting very, very ill from the virus. Seniors, those with who are immunosuppressed, those who have other medical conditions, for example, hypertension, heart disease, diabetes, etc. So those are the three tools: containment, mitigation, and medical countermeasures, so to speak. And so those are the tools that we have to battle COVID-19.